I'm Dr. Yung Hua. I'm an orthopedic spine surgeon. My specialty is actually in spine surgery. I come from Singapore. I work in Parkway, Mount Elizabeth Novena Hospital in Singapore. Okay, spine surgery has been evolving over the last few years. What we used to see as a conservative treatment for spine surgery, now actually we are doing more and more advances in the spine surgery. We have seen new technology coming up, we have seen new equipments and also new forms of treatment. I can see that currently more people are actually accepting spine surgery because of the safety aspect. And also doctors can plan the surgery well and target exactly where the patient's problem is and get them well. So spine surgery in a global sense actually is becoming a specialty by itself. In the past, people may be orthopedic surgeon doing some spine surgery or neurosurgeon doing some spine surgery, but now actually it forms a discipline where they are fully doing spine surgery and they're getting better and better and with better acceptance by the patients. The challenge is actually getting the patient well, because we know that the complaint of the patient usually is pain. And sometimes pain is a very subjective thing. We may be doing the best surgery, but we are not targeting at the right place. So having the right diagnosis with nowadays with new technology like MRI and also some neurologically studies, we can actually find out exactly what the patient's problem is and treat it so that the patient can get a good outcome. Sometimes we also do deformity correction, but knowing the right parameters, because the new trend is that people are actually looking at good sagittal balance as well as coronal balance. When you have a good balance, you do the right surgery, correct their deformity, and you can get a good outcome. The other thing is that we are seeing more and more of aging population. As we know that as people age, the spine also age. So there's a lot of degenerative changes. So the challenge in treating elderly patients with spine problem comes that many of them have underlying medical conditions. And doing a big surgery on this patient carries a higher risk. Number two is that when the elderly comes in, they also may have a bone that's osteoporotic. So that poses a challenge if we are doing instrumented cases where we have to put implants in the patient. So we have to devise systems where the implant can sit well and the bone can heal adequately. Younger generation pose a different problem. We can divide into probably two types. One may be as we say, is the injury related, maybe sports injury. Many of them engage in sports injury and they get injured. For example, they're having a herniated disc where we have to deal with it. But many others may be some form of deformity. We do see young patients with deformities such as scoliosis or kyphosis, where we monitor them and some of them are bad enough that they need surgery. So correcting this deformity at a young age will give them a good outcome and they can carry on into their adult life without any problem. In Singapore, I think we can take pride in that we have a good team of doctors who are well trained, because Singapore is actually quite a small country, so there's a lot of collaboration between the doctors. And we have regular meetings where we discuss different cases and improve on each other. We recently have formed our own society, Singapore Spine Society, where all the spine surgeons come under the same umbrella. And I myself is currently the vice president of the Singapore Spine Society. We organize talks, we organize symposiums, and get everybody together. Singapore also can be considered a developed country. We have a lot of latest technology. We usually adopt all this new technology with collaboration with other countries in the Western country, whether it's Europe or in US, and we bring in the new things and we develop them. So in Parkway, we are proud to say that we have many new things like navigation, we have good teams of doctors, we have new equipments, and we have very good, capable doctors who can deal with most of the complex spine cases.
Would you like to mention any of the latest medical devices?
I think the latest now, other than the improved implants, the improved navigation system. We also have good neuro monitoring where we can monitor the patient's neurological status during the surgery to avoid any damage to the nerve. The latest thing that we have brought in is actually the robotic surgery. But I think robotic surgery has still a very limited use, but more and more cases have been used in robotic surgery. It's a field that is still developing, and I think there's a future where it can make spine surgery more accurate and also safer for the patient. I think the future of spine surgery is that we are more targeted at training a group of dedicated surgeons who will deal with the complex cases of spine surgery. And we know that there are a lot of cases that have been done over the years, and many of them may have recurrence or some failures. So I think the challenge in the future is that we are dealing a lot more of revision spine surgery. Revision spine surgery can be a tough situation where we have to redo the surgery or to correct some mistake that have been done before. So that is something that is going to take up a lot of our challenge and also come with higher risk. So having a team of doctors who are trained and can work together, I think this is a good way to go.